Hello, this is Dr. Do again. This video is still our alphabetic list problems on letter S. Today I'm going to talk about the serum and its application for diagnosis and also for treatment for therapies. So basically this serum, you probably heard a lot of serum. What is the serum? I think serum it's it is part of the blood, the liquid form of blood. There's another term, plasma. What is different? They're all the liquid form in the blood. Actually, if you talk about the component of blood, which is by the way, it's a connective tissue, just like the bones or the muscles or the fibrotic tissues or adipose, or these belong to the same group called connective tissue. The blood is also, however, it's liquid form. And we talk about the blood has the component of the liquid form, which is plasma, and also the cells, like the red blood cells, white blood cells, and also the lymphocytes, for example, and also the platelets. So this is about this is about part of the blood. So what's the difference? What is the serum referring to? Serum referring to the liquid part of the blood after the blood coagulates, which means in the liquid form of the blood, there are a lot of coagulation factors. So during this coagulation process, so when the blood is drawn, there is no anticoagulate in the tube. So which means that naturally the blood cells will coagulate together, forming the clot. During this process, use up all the coagulation factors in the plasma. So that is the serum, the upper part of the clear fluid is the serum. And also the plasma is just after the blood draw, just let it settle down without any coagulation. So this is, you add the anticoagulate component in the tube when the blood is drawn. The blood cells just settle down without coagulation, which means in the plasma there's still coagulation factors. So this is the difference between the serum and the plasma. In terms of diagnosis, pretty much I think there's some specific has to use serum, or some of the microelements, for example, has to use the serum, or some of the protein has to use the plasma. However, this kind of can be really interchanged to use to test some majority of the purpose to serve as diagnosis. For example, if we do the antibody test, we can use the serum because that's the globulin, which is really rich in serum. So usually for the antibody test, we talk about the antibody test that use the serum, and sometimes plasma can also be used, but I think serum probably is more commonly used. And also serum is where we produce antibody. We immunize, for example, we generate antibody, we immunize the special kind of animals, and then draw the blood and take the serum and to extract those antibodies, to make those antibodies, and either for research or for the therapeutic. So this is about the serum. And the plasma sometimes can test the coagulation factor, of course, and also other component or other disease factors. Sometimes use the plasma to diagnose specific factors for specific diseases. And both of them can use as therapy, actually, because serum and the plasma, they are rich of the proteins, albumin, globulin, which are really essential for a lot of functions. So that's why the serum and also serum contain the antibodies. So in terms of the treatment, the therapeutic use, they both can use in a variety of the conditions. For example, the unhealed wound, sometimes probably, especially in those sensitive part, lack of blood vessels, in those kind of tissue, need to be cured, or the wound can need to be healed, for example, in the eye. Sometimes the patient blood is drawn and generated the serum, and then put it back there to dress the wound, to accelerate the wound healing. And also, this is in this serum also have some other component, which is really like fibers, for example, to heal the wound. And also for some chronic disease like the joint, for example, chronic joint pain, inflammation. Sometimes we use the steroid, for example, or anti-inflammatory, non-steroid anti-inflammatory medications. But sometimes I think this is a new method of treatment. There's the selection criteria for who is the best candidate for this. Can use the plasma to draw the blood from the patient, and then to extract the blood plasma or the serum to inject into the joint. So this is because the rich component of the serum plasma can really promote the anti-inflammatory process. So this is to heal the pain. Actually, it's quite if you imagine, should be very efficient, should be because the joint and the eye, I'm talking about the wound, sometimes there's not enough blood vessels to supply the nutrients in order to heal or in order to function as anti-inflammation. So that's why the serum plasma can use as this. And also clinically, a lot of time for particularly special patient, instead of the transfusion of the whole blood, a lot of autoimmune diseases, for example, like Guillain-Barré or some other autoimmune diseases, can use this plasma to because this antibody generated in the circulation blood contain this antibody continuously to attack cell. So this is the treatment is to draw your plasma out and to replace with normal fresh plasma to treat this kind of autoimmune diseases. Actually, it's one of the most efficient way to treat acute autoimmune diseases, which means after the upper respiratory tract infection, you develop the symptoms because the body fighting the viral or bacteria. At the same time, the antibody recognizes itself as the foreign body. So that's why circulating this plasma has this antibody. So sometimes the treatment, I think the best radical treatment is to undergo this exchange of plasma to draw the blood out and then put in new plasma to replace and to get rid of the antibody which attacked the cell. So this is about the serum and plasma. In terms of in general, I think this is just is a general introduction for the concept. And also sometimes if you're the one who receiving the therapy, either serum or plasma, you might question what is going on. I'm sure your physician explained to you. I'm just take another time to remind you or from the fundamental knowledge to explain why those can be used as a therapy and also the diagnosis and what's the difference. So this is about the video of serum and its application, diagnosis and therapy. I'm going to stop here today and thank you for watching. I will see you next time.